Now, most of you know by now, if not, we want to be eating an anti-inflammatory diet, right? You can read my book, An Inflammation Nation. You can go back and see my variety of videos here on The Real Truth About Health. I go that into detail, but this is my slide that I always want people to say, this is probably my most copied slide and then my most important slide to show. If you take a photo of this or you print it out, I give this to my patients all the time because all you really need to know is this slide. If you know this slide, then anybody going forward that you hear on social media, on the internet, whether they're an MD or holistic doctor, naturopath or chiropractor or an influencer, it's like you just go back to the slide and you have to say, are you on the side over here being anti-inflammatory or pro-inflammatory? And I'll go through briefly some of these things, but this is all you really need to know. These lists actually can be a lot longer, but I've kind of taken the highlights of the most important things of like what's pro-inflammatory, what has cholesterol, what has inflammation, what causes dysbiosis and dysfunction in your gut, what causes more risk of cancer and blood sugar problems and toxicities. And you'll understand that once you understand the science, it's like the science is this. You want to be eating more plant-based diet, plant proteins, etc. So if you have high cholesterol, let me just go back here. So animal protein causes inflammation, right? Increases your CRP, interleukin 6, TNF alpha. It also increases omega 6s, which is pro-inflammatory, has oxidative cholesterol, right? Has no phytonutrients, little to no antioxidants. Even if you're eating grass-fed, organic, wild-caught, free-range, still little antioxidants, has no fiber, increases dysbiosis, endotoxins, inflammatory markers in your gut, contribute to all these kind of pro-inflammatory and pro-cancer markers. Can increase blood sugar, and we'll talk about toxins in a minute. But plant foods are just the opposite. It reduces inflammation. It has high omega-3s, has no cholesterol. And that's why all these doctors and all these providers on these panels on The Real Truth About Health, they'll say, hey, you can reverse heart disease by just not eating this type of food. Eat more plant diet. Eat a plant for diet. But we want people really just to go eating a full whole food plant-based diet as much as they can. And in fact, we have the largest practice now in the Southwest of plant-based patients. Phytonutrients, antioxidants, fiber, this is only coming from plant-based foods. So when people take tons and tons of supplements, right, and all the antioxidants, lycopene, lutein, curcumin, green tea, resveratrol, all these kind of phytocolor chemicals only come from plant foods. It doesn't come from beef, chicken, pork, dairy, lamb, etc. Okay, and so we'll talk about all of these things, but you really want to be coming back to this. So when we talk about heart disease, if you have high cholesterol, we know that the numbers are bad, right? If your bad cholesterol, which is LDL, and your total cholesterol is elevated, then there's risk, right? We know that there's heart attack and stroke, that the pipes are clogging, as they'll say, right? But we go further because a lot of people, they might see their doctor and they go, well, my cholesterol is not so bad. It's about 10 points high or 15 points high, or maybe it was 100 points higher and they took a drug like a statin, or maybe they switched their diet from standard American diet to Mediterranean diet. So they maybe dropped 50 points, but they're still elevated. What we want to go is to show them to further evaluate what their risk is by looking at the particle size, the particle density, right? What it means is that we can look at your bad cholesterol and of that number, whether it's high or low, see whether it's more likely to cause plaque and stick. And if it does, even more reason, regardless of the number, to bring it down, because we're all about risk reduction in my practice. It's not about perfection, but it's getting to have all your numbers in all sorts of categories within the normal range or even better than the normal range, because we're trying to prevent the onset of the most common cause of death, which is heart disease in America. 3 people every minute have a heart attack in the United States. Number 1 cause of death worldwide still is heart disease. Number 2 is cancer. Number 3 is ongoing still is COVID. So getting your numbers down is important. Now, also a lot of people might have is good cholesterol elevation. Their HDL, I call it the happy cholesterol. It might be high. I had a patient the other day, her HDL was 103. Now, anything above 60, we found it, okay, that's doing really good. 103. So all our doctors said, hey, you can do whatever you want, eat whatever you want. Your good cholesterol is fantastic. However, when we tested her, we found out that her HDL is not doing its job. Okay, so what we have to make sure is that the numbers, just because it's high or just because it's low, what's the true assessment of that risk? And some people can have very high HDL, and it still doesn't provide them enough benefits of saying, hey, you get a get out of jail free card. You can eat whatever you want. And if anybody tells you, especially your provider, that your cholesterol is high, but that is normal for your age, so you're 60, you're 70, you're 80, or 90, and they're saying, well, you're 85 years old, it's okay to have the elevated cholesterol, then shame on them, really. Because when we look at people who live the longest, who even in the blue zones, for example, their cholesterol levels are going to be lower. And so we do know that keeping that down, regardless of your age, is super important. Now, if your cholesterol is still high, and you're saying, gosh, I am a whole food plant-based person, Dr. Pai, or they're maybe eating Mediterranean diet, or they come to my office and they're eating a quote clean animal protein diet, but they're avoiding a lot of saturated fats and they still have elevated cholesterol and LDL. What else could be the cause is that they might be a overproducer or overabsorber. So we want to test that, because especially when people move plant-based and they're strict, and then we say, okay, no saturated fat, no, excess coconut oil, cut down all the other things from packaged foods and processed foods as much as you can, but then they still have elevated cholesterol. They can be producing too much, right? So this is a smaller portion of people. Remember, 95, 98% of people that have problems with their lipids is dietary intake. So we got to reduce that. But there's going to be a small percentage of people who come in, their cholesterol's elevated, they're eating a fantastic diet, and yet they still have this issue. We still have to reduce the risk. But what is the cause? The cause can be that their body's producing too much, or they're absorbing too much. If they're a super absorber, we call it over absorber, what that means is that their body's like, their GI tract is like a Dyson vacuum cleaner. Its cyclonic action is going to suck up every molecule of fat. And so I've got patients who are completely plant-based for 20, 30 years before even the word vegan, was out. Hardcore, living farm to table, and they eat one bag of potato chips and their cholesterol can go to 300. So we have to be careful, because we want to make sure, on certain people, then even though we know what their issue is, we still have to reduce their risk. So how do I reduce the risk? Well, obviously you go for plant-based diet, 90% of people, their lipids will go down. Boom, heart disease can reverse. We do that a lot. A lot of the doctors here on the panels that you'll see on these programs will show you their patients and their cardiovascular studies. We have patients like that too, which after we've learned from them, we can reverse heart disease. So that's kind of like a no-brainer. We can reverse the heart disease. But for those people who are producers or over-absorbers, I still want to reduce it. We use a product called Monacolin, which is one of my favorites. It's got 30 patents, 100 clinical trials. And interesting thing is, it was a new dietary ingredient approval by FDA in 2020. What that means is that in 2020, during the pandemic, the FDA came out with a rule, because there's this issue with dietary supplements. And like you just recently heard with Japanese red yeast rice that came out just recently, there's been 5 deaths and 100 people hospitalized in Japan because the company was using red yeast rice and it has its contaminant in there, and it got into the supply. Also, some of the food contaminants as well. So what we have to look at is, this comes out of South Korea, and they were looking at all the different parts of the molecule of the red yeast rice. Just like all plants, they have hundreds of phytochemicals, right? Like kale will have like 90 different phytochemicals. So they're looking at the red yeast rice, and instead of the ones that were standardized before that was similar to statins, right? That was a popular thing back then, and then that became illegal because it was patent infringement against the statin companies. They were looking at then the other molecules, and they tested all these hundreds of molecules, and they found 2 other molecules in that plant that can actually reduce it, but not only reduce it, does not deplete CoQ10, does not cause kidney or liver problems. And then they had to do all these clinical trials. And so what that means is that in 2020, you cannot bring a new product into the dietary supplement market unless you have clinical trials on safety and efficacy. So now it's raised the bar really high. So what you'll see right now in the last 4 years is that you don't really see new ingredients. What you see is older ingredients that have been grandfathered in that have a new delivery system. Like this is liposomal, this is a effervescent, this is a gummy. Like we can only give supplements now because unless you have the money and the backing, which this company did because it's from another country, they invest in natural therapies because they're not stuck on, oh, this is a drug company or this is going to be covered by insurance. They're looking at what does the science show us that we can healthily reduce lipids. Now, again, plant-based diet first and foremost, but for those people who are still having difficulty in lowering it, we still got a lower risk. So monoflavin is my favorite product to use. Now, again, going back to the plant protein, so we're reducing all the inflammation here, we're reducing the heart risk, but also what you're doing is when you're eating more plant foods is that you're reducing insulin-resistant blood sugar problems, advanced glycolation end products, right? And you're increasing your metabolic rate. So if those people have blood sugar problems, eating a plant-based diet is something that will be shown. And there's a lot of practitioners on this thing, even diabetics, I believe, on the course here, that have reversed their diabetes. And we see that all the time. We help patients all that. Even type 1 diabetics can help improve their overall function and form just by going plant-based. Now, if you're having blood sugar problems, a lot of doctors will just get a fasting glucose with your metabolic panel. It's part of the panel, right? And most people are getting their lipids checked, their cholesterol, so it's fasting. So they get it in the morning. But that can be misleading because a lot of people can try to game the test, right? Like, for example, like when people have a dental appointment, like the 2 days before, a lot of people are brushing and flossing a little bit more than they would normal because they want to go in and have a good result from their doctor saying, hey, you've been doing your job. Or people sometimes like, well, I had a company came in, or maybe last night was my kid's graduation or my anniversary, and they ate a little bit too much because in celebration, and the next morning their glucose can be a little bit higher than it actually traditionally is. So the fasting glucose is kind of a misnomer sometimes because it's fluctuating. It's like the stock market. It's going up and down, up and down. Stress it alone, even if you eat a perfect diet, can raise your blood sugar. Right. So when we look with our patients on how to get their blood sugar, it's not just, drive it down with a drug or a supplement or exercise more. It's getting the stress reduction super, super low, getting your stress balanced because stress is a pro-inflammatory effect as well. But you want to be getting what I call a hemoglobin A1C, which most people understand what that is. They've seen it, but you don't have to be a diabetic to get this. You should be getting this on every patient. I get it on every patient for the last 24 years. The reason being is that we want to look at your 3-month average. What is that average? Because, some days we fast, some days we famine, some days we're feasting, right? And so we want to look at between the average of our lifestyle over 3 months, we can see, is your blood sugar going up? Is it stable? Or actually, is it going down and you're improving your overall metabolic function? You also can get a fasting insulin because some people can have a normal hemoglobin A1C, but if we see this elevated spike in fasting insulin, then that's kind of the early warning of a tsunami to come where eventually it'll just tip and all of a sudden their blood sugar will start to rise. Now, the goal is to have, you'll see most laboratories 5.6, 5.7. We actually like it to be 5.4 less because that's what it was when I was a medical student 35 years ago. And so this is important because even this test is being skewed because as the population of who we draw the labs from, each laboratory is different. And we average those 50 to 100 people in the lab, their blood sugars. As the population itself, even the providers in the lab, doctors and nurses and lab techs, are also getting blood sugar problems due to standard American diet, then that skews this test. So you can look, and even the range of what a 5.6 or a 5.7, what that actually equals in terms of mean average glucose varies from city to city. So it's different in Mississippi, different in Chicago, different in New York, different in Manhattan, different in Las Cruces. It's different. And so we can't just say, a 5.6 is a 5.6. You'll have to look at the test and see what that mean average glucose is actually meaning, because as the states who have more obesity and more blood sugar diabetic problems, this A1C is getting skewed. So a lot of people can have a 6.4 and it would still be considered normal by the lab test. Okay. And so a lot of people get their screening saying, your A1C is normal, but that range of what normal is also being skewed. So I like to be a little bit more on the conservative side because elevated blood sugar is a pro-inflammatory first domino that knocks down everything from heart rate, cardiovascular, blood sugar, blood pressure, pro-inflammatory systemic issues. And if your doctor says, well, your blood sugar is elevated due to your age, or that's normal for your age, again, shame on them because age is not an excuse for having elevated blood sugar. Now, if your blood sugar is still elevated, what do I recommend? Well, we have natural therapies. Now, obviously, we can prescribe prescription drugs like metformin and and there's many other drugs that are out there. But I like to look and utilize certain nutrients that will help how the liver produces less cholesterol, how we can get natural therapies that lower not only the blood sugar, but cholesterol well, like a 2-in-1. Also, there's certain herbs that we give, like in our glucose formula, Ayurvedic herbs, that help lower the sensitivity of someone's craving sweet. A lot of people come into me and say, Dr. Pai, I have a sweet tooth. I have a sweet tooth. Like they don't mean to eat, but they just crave the sweet. And there's medicines and natural medicines in Ayurvedic medicine that actually over time help desensitize. You're not craving the sweet. So it's not a new weight loss drug that people are promoting and they're getting these injections that slow down your gut, and actually it's an aversion therapy. You're not eating. And there's a whole lecture I've given on the dangers of those new Ozempic, Wegovy, and those kind of drugs that are marketed right now. We want to look at improving your overall form and function. And so we can do that. And even like with our berberine advance, which is a newer form of berberine, we can actually get your lipids down, which is your cholesterol, and your blood sugar safely. But again, working on the diet first and all these other tests I'm going to recommend, these are just things to help move and transition. Eventually, we want people even off natural therapy because their body should be metabolically balanced.